It is my distinct pleasure and privilege to introduce this morning's keynote lecturer and honoree, Dr. Sherry Glied, who is the Assistant Secretary for Planning and Evaluation at the U.S. Department of Health and Human Services. And I think I speak for many in the room when I say that we were absolutely thrilled when President Obama nominated Dr. Glied for this position. Previously, Dr. Glied was Department Chair and Professor in the Department of Health Policy and Management of Columbia University's Mailman School of Public Health. She is a leading health economist and researcher, and through her work has made remarkable contributions to health and mental health policy reform in the United States. Dr. Glied has an extraordinary reputation as a health economist, as evidenced by her appointment and membership on important advisory committees and boards. She counseled former Presidents Bush and Clinton on healthcare policy, where from 1992 to 93 she served as a senior economist for healthcare and labor market policy to the President's Council of Economic Advisors. In the latter part of her term, she participated in the Clinton Healthcare Reform Task Force. She has been elected to the Institute of Medicine of the National Academy of Sciences and to the Board of Academy Health. She is a member of the MacArthur Foundation's Network on Mental Health Policy, and she was also a member of the Congressional Budget Office's panel of health advisors. Dr. Glied's principal areas of research are in health policy reform and mental health care policy. Her cutting-edge research on health policy has focused on the financing of healthcare services in the United States. She is an author of numerous published articles and reports on managed care, the design of health insurance expansions, women's health, and children's health. Her book on healthcare reform, Chronic Condition, Why Health Reform Fails, which was published in 1998, provides an analysis of the causes of the U.S. healthcare crisis and the limitations of previous reform efforts. She has conducted research sponsored by the Commonwealth Fund on the characteristics of uninsured Americans and on strategies to expand health insurance coverage. She is a previous recipient of a Robert Wood Johnson Investigator Award, through which she studied the U.S. employer-based health insurance system. In a book entitled Policy Challenges in Modern Healthcare, which was published in 2005, Dr. Glied authored a chapter on the employer-based health insurance system, in which she advocates for a complex mix of proposals to expand coverage, including maintaining employer-based healthcare, the institution of mandates, a public health insurance program as a fallback for people who can't find coverage elsewhere, and a system of tax credits. Sound familiar? Obviously, if you've read the Affordable Care Act, then it does. Dr. Glied has also recently looked at changes in U.S. life expectancy and whether our bad habits or a healthcare system are to blame. In a 2010 Health Affairs article, Dr. Glied and her co-author find that most of the commonly cited reasons for the lower gains in life expectancy in the United States as compared to other wealthy nations, population diversity, smoking and obesity rates, and the high number of uninsured people, are not likely to be valid. Instead, they speculate that the nature of the healthcare system itself, its reliance on fee-for-service and specialty care, may explain both increasing spending and the relative deterioration in life expectancy. If this is true, as the authors state, meaningful health reform may not only save money over the long term, it may also save lives. Her research in mental health policy has been equally compelling and significant. She has done extensive work focusing on the problems of women and children. She's an author of 2 reports to the Commonwealth Commission on Women's Health on the changing pattern of mental health service use by women. She's also written extensively on the economic determinants of children's mental health service utilization. But perhaps her most noteworthy contribution to the field of mental health policy is her book co-authored with Richard Frank entitled Better But Not Well, Mental Health Policy in the U.S. Since 1950, which was published in 2006. This book provides a candid and comprehensive assessment of mental health care in the United States and of the well-being of people with mental illness over the past 5 decades. And if you haven't read the book, I highly recommend that you do. They state in the beginning of the book, and I quote, "People with mental disorders are among the most vulnerable and disadvantaged members of U.S. society. America's struggle to address mental illness in its population humanely, efficiently, and fairly has advanced greatly. People with mental illness are much better off than they were just 50 years ago. Nevertheless, we remain limited in our ability to reduce many of the disabling and destructive consequences that allow people with mental disorders to live with dignity and meet their basic needs. Our system of care is not yet well. Dr. Glied is highly respected for her candid, pragmatic, innovative research and analysis of health and mental health policy. She has undertaken numerous ambitious, groundbreaking studies that explore significant healthcare policy challenges and put forth new solutions for improving our nation's health and health system. More importantly, her work contains the meaningful evidence that is critical for educating policymakers and helping them make informed decisions that will have a lasting impact on our health and behavioral health care systems. Many of us admire Dr. Glied for her brilliance, quick wit, and her unsurpassed ability to communicate complex issues at lightning speed, which we are all looking forward to. We are delighted for the opportunity to honor Dr. Glied, a distinguished leader whose outstanding contributions have been instrumental in shaping behavioral health policy in the United States.